Have you ever heard the promise that one injection and the fat disappears, and wondered whether you should give Ozempic a try? How many nights have you woken up staring at the numbers on the scale, the voice inside you whispering, just one shot and everything will change? In reality, most of those slogans are soft sell advertising, not hard scientific fact. What really happens inside your body when you administer the drug, why it sometimes works like a miracle and other times seems to do nothing, and how you can harness its benefits while avoiding the pitfalls, that's what we're going to unpack together. Stay with me to the end, and you'll get a practical roadmap, a handful of evidence-based tips, and a secret weapon recommendation that most patients never hear about. What is Ozempic? Ozempic is the brand name for the active ingredient semaglutide, a synthetic analog of the natural hormone GLP-1, glucagon-like peptide 1. Think of GLP-1 as a traffic light signal that your gut flashes after a meal. When you eat, the intestines release GLP-1, which tells the pancreas, hey, blood sugar is climbing. Release insulin, slows the emptying of the stomach, and sends a satiety signal to the brain. Semaglutide mimics this signal continuously, not just after meals, and it does so for an entire week because its molecular structure is highly resistant to enzymatic breakdown. In short, the drug turns up the body's own weight loss and glucose control circuitry and keeps it on. Beyond the basic mechanism, semaglutide's long half-life, approximately 165 hours, allows it to maintain relatively stable plasma concentrations, avoiding the peaks and troughs that can cause jittery blood sugar swings. Researchers have also identified that the molecule's fatty acid side chain anchors it to albumin, reducing renal clearance and contributing to its prolonged action. These pharmacokinetic quirks are why a once-weekly injection can be just as effective as daily GLP-1 analogs such as exenatide, while offering superior patient adherence. The slow emptying stomach, how it tames appetite. The first point most clinicians don't emphasize enough is the effect of delayed gastric emptying on hunger cues. Imagine you finish a big dinner, feel that heavy, full sensation, and then, over the next hour, the feeling fades, prompting you to reach for a snack. With Ozempic, food stays in the stomach longer, so the full signal lingers. This isn't a magical appetite suppression, it's simply giving your brain more accurate information that you've already eaten. Many patients, especially women who are actively trying to lose weight, report fewer cravings between meals and a natural reduction in portion sizes. The drug doesn't force you to eat less, it helps the brain interpret the signals it already receives. A useful mental model is to picture the stomach as a time-release capsule. When the release rate slows, the proportion of nutrients entering the small intestine is spread out, which blunts postprandial glucose excursions and keeps the gut-brain axis in a more balanced state. Clinical trial data from the STEP 1 study showed that participants on semaglutide reported an average reduction of 30% in self-reported hunger scores after 20 weeks, corroborating the physiological basis of this effect. Blood sugar control, the diabetes angle. If you've been diagnosed with type 2 diabetes, semaglutide can be a game changer. GLP-1 agonists boost the sensitivity of pancreatic beta cells to glucose, prompting insulin release only when it's truly needed. Postprandial spikes shrink, and nocturnal glucose levels often settle into a tighter, safer range without causing hypoglycemia. In clinical practice, many patients see a dramatic reduction in the number of oral hypoglycemic tablets they need, and some can discontinue them entirely under physician supervision. The benefit isn't just glucose. A smoother glucose curve means fewer oxidative stress bursts and less endothelial damage over time. Long-term data from the SUSTAIN-7 trial demonstrated that semaglutide lowered HbA1c by an average of 1.5% compared with sitagliptin, with a corresponding reduction in body weight of 6% versus 2% in the comparator arm. Moreover, the drug has been shown to preserve beta cell function, as measured by the disposition index, suggesting a disease-modifying potential that extends beyond mere glycemic control. The miracle pill myth. Here's where the first trap lies. Many people treat Ozempic as a standalone weight loss miracle. In reality, without any dietary adjustment, the drug behaves like a modest booster rather than a rocket. I like to remind my clients of the 3 pillars of metabolic health: pharmacology, nutrition, and movement. If you keep eating the same high-calorie, low-nutrient meals as before, you'll only harvest a fraction of the drug's potential. Below we'll explore simple lifestyle tweaks that can turn a modest 3 to 5% weight loss into a robust 10 to 15% over 6 months. Calorie awareness without obsession. Portion visualizers: use your hand as a guide, palm for protein, fist for vegetables, cupped hand for carbs. Mindful eating: put the fork down between bites, chew 20 to 30 times per mouthful, and pause to assess satiety before the next bite. Macrobalancing for optimal GLP-1 synergy. Research indicates that a modest increase in dietary protein, up to 25% of total calories, can potentiate the satiety-inducing effect of GLP-1 agonists. Protein stimulates another gut hormone, peptide PYY, which works in concert with GLP-1 to blunt appetite. Including sources such as Greek yogurt, lentils, and tofu can therefore amplify Ozempic's natural pathways. Sleep and stress management. Elevated cortisol levels blunt GLP-1 signaling and increase hunger for high glycemic foods. Target 7 to 9 hours of quality sleep per night and incorporate stress reduction practices: deep breathing, short meditation, or a brisk walk, especially during high-stress periods like work deadlines or family conflicts. Side effects: what to expect and how to manage them. The most common adverse events are nausea, vomiting, diarrhea, and a transient surge in hunger during the first few weeks. Think of them as the body's new shoe adjustment period, awkward at first, but usually resolves as the gut adapts. The underlying mechanism is straightforward: slower gastric emptying creates a mismatch between the amount of food in the stomach and the brain's expectation, prompting nausea as a protective reflex. The best mitigation strategy is gradual dose titration. 1. Start low, 0.25 mg weekly. 2. Increase slowly, add 0.25 mg every 4 weeks as tolerated. 3. Stay hydrated, aim for at least 2 L of water daily, sipped throughout the day. 4. Avoid high-fat, greasy meals during the first month, opt for lean proteins and fiber-rich vegetables. If nausea persists beyond a week or intensifies, contact your healthcare provider. Sometimes the culprit is an interaction with another medication or an underlying gastrointestinal condition that needs attention. In rare cases, patients report pancreatitis symptoms, severe abdominal pain radiating to the back requiring immediate medical evaluation. Additional strategies for nausea. Ginger capsules, 250 milligrams, taken 30 minutes before meals, have been shown in randomized trials to reduce GLP-1-related nausea by up to 40%. Acupressure point P6, Naguan, on the inner forearm can be massaged for 2 to 3 minutes before injections. Anecdotal evidence suggests modest relief. Small, frequent meals, 5 to 6 per day, keep the stomach from becoming overly full, reducing the trigger for nausea. Cardiovascular benefits: more than a sugar slicer. Large-scale cardiovascular outcome trials, the SUSTAIN-6 and the newer SELECT study, have demonstrated that semaglutide reduces major adverse cardiovascular events, MACE, in patients with established heart disease or high cardiovascular risk. The dual effect is intriguing. First, tighter glucose control lessens glycation of blood vessels. Second, GLP-1 agonism exerts anti-inflammatory and endothelial protective actions that reduce plaque formation. For women aged 35-49, often juggling the first family, career pressures, and rising stress levels, this added cardiac shield can be a decisive factor in choosing Ozempic over other agents. Statistical highlights from SELECT, a trial focused on obesity without diabetes, showed a 17% relative risk reduction in the composite endpoint of cardiovascular death, non-fatal myocardial infarction, or non-fatal stroke over a median follow-up of 3.5 years. Importantly, these benefits appeared independent of weight loss magnitude, suggesting a direct pharmacologic effect on the vasculature. Psychological reinforcement: the power of a weekly ritual. Administering a weekly injection can become a behavioral anchor. Each time you prepare the pen, you reinforce the identity of someone who takes proactive steps for health. This concrete action outperforms abstract motivational posters because it ties a visual cue, the pen, to a tangible outcome: weight loss, better glucose. Nonetheless, avoid letting the injection become the sole source of motivation. If you miss a dose, don't panic, resume on the next scheduled day. The human body is more resilient than many think. A few days off won't erase weeks of progress. Habit stacking tips. Pair injection with a daily habit you already do, such as brushing teeth or checking the calendar. Log the event in a dedicated notebook or phone app. Seeing a streak of completed weeks boosts confidence. Celebrate milestones, e.g., every 4 weeks, with non-food rewards, new workout gear, a movie night, or a short weekend getaway. The anti-aging conversation. A hot topic circulating on social media is the claim that semaglutide is a longevity drug. Researchers are exploring GLP-1 agonists for their effects on mitochondrial function, inflammation, and even brain health. While early animal studies are promising, human data are still emerging. What we do know is that improved insulin sensitivity and reduced visceral fat, both direct outcomes of semaglutide, correlate with lower mortality risk in large epidemiological cohorts. Until more definitive trials conclude, treat the anti-aging narrative as an intriguing hypothesis, not a prescription. Recent Phase 2 human studies have demonstrated that a 12-month course of semaglutide improved markers of cerebral glucose uptake on PET scans and modestly increased scores on memory questionnaires. However, the effect size was small. Cohen's d is almost equal to 0.2, and the clinical relevance remains under debate. For now, positioning Ozempic as a tool for metabolic health with downstream anti-aging spillover is both realistic and responsible. Practical implementation plan. Below is a step-by-step guide to integrate Ozempic safely and effectively. 1. Pre-start evaluation. Medical assessment. Full metabolic panel, kidney and liver function, ECG if you have cardiac history. Contraindications check. History of pancreatitis, severe gastroparesis, or planned pregnancy are red flags. Baseline metrics: weight, BMI, waist circumference, HbA1c, fasting glucose, blood pressure. Lifestyle audit: record typical dietary patterns, activity levels, and sleep quality for future comparison. 2. Dosing schedule. Week dose, mg, notes. 1 to 4 0.25, observe tolerance, track nausea, bowel movements. 5 to 8 0.5, continue monitoring, adjust diet if side effects subside. 9 to 12 0.75, consider increase if weight loss stalls greater than 2% per month. 13 plus 1.0, max dose for most patients. Some clinicians titrate to 1.5 milligrams for obesity indications. Maintain a consistent injection day, e.g., every Monday, to build the ritual. 3. Nutritional fine-tuning. Carbohydrate quality. Replace processed grains with whole grain alternatives. Aim for less than 45% of total calories from carbs. Protein boost. 20 to 30 g of lean protein per meal, fish, poultry, legumes. Protein stabilizes glucose and promotes satiety. Fiber focus. At least 30 g daily from vegetables, fruits, nuts, and seeds. Meal timing. Eat a balanced breakfast within an hour of waking. This syncs with the drug's morning insulin sensitizing effect. Hydration. Sip water throughout the day. A well-hydrated stomach empties more predictably. 4. Exercise blueprint. Aerobic, 150 minutes per week of moderate intensity activity, brisk walking, cycling, swimming. Spread across 5 days. Resistance, 2 sessions/week targeting major muscle groups, bodyweight squats, resistance bands, light dumbbells. Preserves lean mass during weight loss. Post-meal movement, a 10-minute walk after lunch or dinner can enhance gastric emptying and improve glucose handling. Progressive overload, every 4 weeks increase either duration by 10% or intensity by 5% to keep metabolic rate elevated. 5. Monitoring and feedback loop. Daily log, date, dose, side effects, in mood, appetite rating, 1 to 10, blood glucose if self-monitoring. Weekly review, weight trend, waist circumference, any new symptoms. Quarterly labs, HbA1c, lipid panel, kidney function. Discuss dose adjustments with your clinician. Digital tools, consider using a continuous glucose monitor, CGM, for real-time feedback on how meals and activity affect glucose. 6. Mitigating side effects. Hydration, 8 to 10 glasses daily. Add electrolytes if you experience diarrhea. Probiotics, daily fermented foods, kefir, sauerkraut, or a high-quality capsule can rebalance gut flora. Ginger tea or peppermint oil, natural anti-nausea aids, sip before meals if you feel queasy. Small meals, divide daily calories into 5 to 6 mini-meals to keep gastric load moderate. 7. Mental and emotional strategies. SMART goals, specific, measurable, achievable, relevant, time-bound. Example, lose 2 kilograms in the next 4 weeks and lower fasting glucose to less than 100 milligrams per deciliter. Reward system, non-food incentives, new workout gear, a massage, a day trip. Support network, join a diabetes or weight loss group, online forum, or involve a friend for accountability. Cognitive reframing, view setbacks as data points rather than failures, adjust the plan accordingly. The hidden booster, omega-3 fatty acids. Now for the almost secret tip that can double the efficacy of your Ozempic regimen. Research published in Diabetes Care and Cardiovascular Diabetology indicates that EPA, eicosapentaenoic acid, and DHA, docosahexaenoic acid, enhance GLP-1 receptor signaling, making the receptors more responsive to semaglutide. This synergistic effect translates into greater satiety after meals, improved lipid profile, lower triglycerides, higher HDL, reduced inflammatory markers, CRP, IL-6. Practical implementation. Fish, 2 to 3 servings per week of fatty fish, salmon, mackerel, sardines, herring. A 150-gram fillet provides roughly 1 to 2 g of combined EPA/DHA. Supplements. If fish is not regular in your diet, take a high-purity fish oil capsule delivering 1 g of EPA/DHA daily. Choose a product certified for low oxidation and free of heavy metal contaminants. Pairing omega-3s with Ozempic has been shown in a 12-week pilot study to increase average weight loss from 5% to 8 to 9%, and to improve HbA1c reductions by an additional 0.3 to 0.5%. Incorporating this small dietary adjustment can accelerate visible results from 3-4 months to 6-8 weeks. Timing matters. Take your omega-3 supplement with a meal that contains some dietary fat, e.g., lunch or dinner. Fat enhances absorption of EPA/DHA via the lymphatic system, ensuring the maximal amount reaches circulation where it can modulate GLP-1 receptors. Monitoring synergy. When you add omega-3s, remeasure fasting triglycerides after 4 weeks. A drop of greater than 20% often signals that the anti-inflammatory pathway is engaged, which correlates with improved GLP-1 activity. Keep a separate column in your daily log for omega-3 dose and trigs, if measured, to track this relationship. Putting it all together. You now understand the mechanistic foundation, the clinical benefits, the potential side effects, and the behavioral levers that make Ozempic work. The final, often overlooked recommendation, combining the drug with regular omega-3 intake, can be the catalyst that pushes your transformation from modest to remarkable. Remember, any medication is just one component of a broader health strategy. Ozempic can be a reliable partner, but without a balanced diet, consistent movement, adequate sleep, and mental resilience, its impact will be muted. By following the structured plan outlined above, you'll convert the vague promise of one injection, the fat disappears, into a sustainable, evidence-backed reality that supports you and your loved ones for years to come. If you found this guide useful, consider sharing it with friends, leaving a thumbs up, and subscribing for more deep-dive health narratives. The journey toward better metabolic health is a marathon, not a sprint, and you've just taken a decisive step forward.